100 parents in the Georgetown County School District and residents have signed a petition that we want to encourage our wonderful school district to head back towards 4 or 5 day in-person instruction. We believe the time is now. We know that there are other counties and school districts across our state that are doing this, and they are showing the way, and we can look to them for guidance and support.
We're here to show that we're willing to work with the district, our schools, our teachers, to try to see some forward progress for our children in their education. The hybrid product is stagnant. Our kids are not moving forward, they're not progressing, they aren't getting the live instruction that they need. The younger kids are really struggling with learning virtually and computer literacy, and the older kids are really struggling with mental health issues, isolation, and just trying to navigate this unprecedented time.
There's an outbreak of COVID-19 nationwide. Houston schools are virtual now. Detroit schools are virtual. This thing is getting serious every day. And if you make the decision to go back face to face, should one person die because of COVID, that one of those little children out there wearing those signs, if they would die because of COVID, what would you do? You have to look at yourself, because their death will be on y'all's hands.
I stand today to say to you that as you make your decision, think about our children who are coming back to school face to face for 4 or 5 days. We are taking a big risk. Even in the Welcome All Day as a pastor, we have not even having our congregation back together because of the risk that we will be taking as a pastor, as a leader. And so today I'm saying and asking you to take this very serious, because I can stand today as a witness to tell you this COVID is very serious.
As of November 15, 2020, Georgetown had tested 26,000 people out of 60,000 plus people. Identified 2,613 COVID, 237 hospitalized, 63 deaths. Many have said that this is no more than the flu. That is not the case. We never shut down a school district because of the flu. If that was the case, our economy would not be shut down right now. The flu don't shut down our economy.
So currently we have, according to the dashboard as of today, 3 students, and we're at 0.045% of all of the schools in the county. I'm here to attest that PPE works. No one wants to put our teachers, custodial workers, cafeteria workers, bus drivers at risk. Our staff is a testimony that PPE works. I've treated many, many, many COVID patients, have not gotten sick because I wear my shield and my mask. I cannot attest to what folks do outside of their workplace. Many of the cases that we have seen from folks who work in places like hospitals and education contract it when they're from funerals, from other family members' gatherings, from a family member they didn't know who came over to eat and suddenly they got it. It is not from the protocols that y'all have set in place. They're there for a reason and they work. Gosh darn it, they work. Okay?
I'm a special ed teacher. I teach hybrid and I teach virtual simultaneously. Please, Dr. Toxical, about how we're having it easy. Have you walked in my classroom to see it's easy? It's the hardest thing I've ever done, and I teach emotionally disabled students. I teach them. I'm no fun. I'm not afraid. I'm afraid now. Every second of every day, I'm afraid. Please don't tell me that my special needs students don't count. My special needs count a lot, and I'm so tired of the media and the hostile, toxic comments that my students are underserved. No, they are not. We are serving them to the most incredible building. I have incredible special ed staff. I have incredible IT people. I have a board that has made sure we have as much safety as possible. And we're doing it. I have the Lysol hands of the most incredible men. And that's fine. And I am barely keeping them distant and safe. Now teach virtual, teach hybrid, and bring me 5 more children, 10 more children into my room and let me keep them safe. I'm sorry, do not sacrifice one of my students. They are precious, they are special, and they are being taught. And I resent teachers being put down. Do not compare walking into a classroom for 6 hours to teaching or walking into loads. I'm sorry, as a teacher, that would be a 0 for analytical thought process.
I got the impression from the comments that I heard tonight that we were talking about a mandatory face-to-face schedule. I don't think that's what we're talking about at all. I don't think that's what's being contemplated at all, and I don't suspect that's what's going to be debated here at all. One, choice. We have a virtual option, and right now we have a hybrid option. We've heard from a doctor tonight, if we're going to believe in science. We've heard from a doctor tonight. We've heard from the state epidemiologist. We've heard from the governor, who's taking advice from the state epidemiologist. They all agree we need a 5-day-a-week face-to-face option, a choice for parents. Not a mandatory for those that don't want to send their children to school, but a choice for those that do or don't have another option. And that's important. That's what's missing, ladies and gentlemen, is choice. The choice you are making here, going forward, dictates whether a parent can go to work or not. Dictates whether a child may eat or not.